welcome back, everybody. Good evening, good morning for some of you, I guess. Good night as well. So this is the final panel of the conference, and so we will be presenting jointly our ongoing research on into the creeping crisis concept and its application to COVID-19. All of us have been part of this coordinated investigation into how different countries in Europe specifically responded to the COVID-19 pandemic, how the policies were developed in real time, and how decision-making occurred, in a sense, when leaders were under pressure. So I just want to quickly introduce everybody in the panel. So I'm Henry Shields. I am currently working at a crisis plan. Most of you probably know me because I was very much involved in organizing this conference and badgering all of you with emails constantly. I'm also a master's student currently at Leiden University. And then we start with Marte.
Good afternoon. Is that on? Good afternoon. My name is Marte Luesink. I used to work as a research assistant of Arjen at the University of Leiden, and earlier this year I switched to the Institute of Public Physical Safety here in the Netherlands, where I do crisis management research.
Yes, and I'm Annemarie van der Wilt. I was introduced to the crisis management topics during my master research in public administration, where I was supervised by Paul 't Hart, who was here yesterday, and then wrote my thesis research on the COVID-19 response in the Netherlands. And now currently I just started my PhD here at Leiden University, also into the COVID-19 pandemic and also governance of crises more generally.
Hi, I'm Swapnil Vashishtha. I recently just finished my bachelor's in business administration and political science, and during that process I met Mark Reinhardt, who's been here, and now he's back in Stockholm, and now currently I work as a research analyst at the Swedish Institute of International Affairs with Mark.
Hi, my name is Linnea Anderson Formgren, and I worked as a research assistant for Magnus Ekengren in this project earlier this year at the Swedish Defense University, and now I'm currently in my master's at Uppsala University studying human rights, so kind of a different topic, but still related in some ways, I would say.
Okay, excellent. So what most of this conference has been discussing the creeping crisis concepts. These, as many of you know already, are those threats to fundamental societal systems that evolve over time and space, change, they're protracted in their nature, foreshadowed by precursor events, and vary, obviously, in their degrees of political and societal attention. And at least with the COVID case, what is very interesting about it is it presented this kind of experiment almost, where different states were able, or different states with different systems and different backgrounds, different resources, had to face a very similar threat. And people on this panel covered quite a variety of countries, so I personally researched Portugal and Ireland, while others here were representing researching the Netherlands, Sweden, Finland, and Norway. So yeah, just to kick us off, I think, Marte, if you could open your statement, please.
Yes. So the past 2 days and today as well, the Dutch case has been covered quite a lot during the conference. I've done research into the Dutch case as well, primarily on focusing on the first wave response and a second wave response, as well as a comparison with the Swedish response, which we've also extensively discussed already. From a creeping crisis perspective, I find the temporal aspect of the crisis very interesting. So to take you through the Dutch case with a specific focus on this temporal perspective, As we've all known, that every country in Europe kind of felt like they were well prepared. They had all institutions in place, they had all guidelines on paper, and on paper the Dutch also seemed to be well prepared. Yet when the crisis actually hit us, within 2 weeks we kind of had to put the guidelines aside as they already caught up with us. This time-wise is interesting because when we classified the virus as a A-type virus at the end of January 2020, this was first action taken, and you could say relatively on time. Yet in the 6 weeks after that, no following action was taken. During these 6 weeks, however, the threat accumulation happened in China as well as in other countries. At the end of February, it was already very close, and we saw the results of the outbreak in northern Italy. Yet in the Netherlands, we didn't take any action, even when we still had the idea that one index patient would be detected early on in the Netherlands, and he or she would have their contacts traced. We felt like we could contain the virus. However, within 2 weeks, after our first patient, we implemented our first measures, and within 3 weeks, we were in lockdown, something that nobody had expected, and I think that is the first aspect, also from a time perspective. We couldn't imagine it would go this fast. We couldn't imagine it was going to be this intense, and so we've also been criticized in a report earlier this week that the government took actions too late, and especially during the first weeks, this resulted in a higher number of deaths. If we continue, the first lockdown was primarily short, or relatively short compared to the second lockdown. Again, a time component, even though the first lockdown for many felt like ages, we quickly dismantled measures, and at the summer of 2020, we felt like it was the end of the crisis. We had our political recess, our experts faded in the background. This left a vacuum for other experts and other voices to take center stage and to present their perspective, all of which had an effect on the second wave, which compared to the first wave can be argued that our response was less successful. A lot of disagreement was now on the forefront. We had demonstrations, we had opposing experts, especially in the media, proposing their perspectives. And again, also the detection of the second wave was quite late compared to, for example, Germany, where experts after the first wave were looking forward and were already kind of assuming there was going to be a second wave. Dutch experts were like, no, we're going to see if this is actually going to happen, and in case this is going to happen, we will upscale our search capacity, for example, concerning testing and tracing capacity, but also the IC capacity, and we will be ready in January 2021. Unfortunately, the second wave hit us in September 2020 already, and again, we came into this situation where we were behind on the developments of the crisis. I think it's very interesting to see that the second wave still seemed to surprise us, even though the first wave was already there, already happened, and we already felt prepared for the first wave. So how could we be surprised again when a second wave hit us earlier, hit us harder? The measures that were implemented were harder, and they were implemented for a much longer time. If we then look at the citizen response, it's interesting to see that even though compliance declined and even though support for the government declined, everybody, like still the majority, showed support for the strategy during the second wave, and compliance was still relatively high. Also, it shows now by the 85% vaccination degree in the Netherlands. So some interesting points there.
Because you mentioned one thing about how they didn't really learn from the experience of the first wave and weren't able to anticipate. And I think, Anna-Marie, you did some research into that area, didn't you?
Yes, yeah, somewhat similar indeed, because I was focusing on how the preparation before the crisis actually worked out, you could say, when a real crisis hit. So this is my master research. My master thesis research I'm talking about, and I studied that then. It was in the spring of this year. How a large Dutch governmental organization responded to the first wave of the corona crisis, but then in particular the role of the crisis plans and structures they had written down, set up before the crisis had hit them, and see how those structures actually functioned at the moment they had to function during the COVID-19 pandemic. So what I found in that research, but also what I'm reading about and thinking about right now for setting up my PhD research, I want to share with you in my opening statement. And I want to do that by way of summarizing it in 3 points. So the first point I called improvisation, because that was actually the main finding of my master thesis research. So looking at how this large organization dealt with the first wave of the COVID-19 crisis, what you could see is actually that very soon at the start already, the COVID-19 crisis turned out to be much larger than was expected, and on the basis of what these plans were developed for. So you could say actually the crisis was much bigger than the plan on paper. So what this organization had to do, they had to improvise, and they did so in many, many ways. One example, the crisis structures that were prepared, for instance, were not large enough in terms of manpower. So there were too little people actually to manage the crisis in this organization. So what this organization did is they said, every important position, we double it, so that there are 2 people sharing the tasks and dividing the hours. And there are actually many more examples, too many to mention right now. But the interesting thing is actually that improvisation is really an echo of what we also see in the crisis literature. That the literature also often reminds us that the reality of crises is often much more complex than we anticipate in the crisis plans we develop, which is also why Clark famously called them fantasy documents. And this makes improvisation an often necessary strategy during crisis situations. So, and that makes me wonder and brings me to my second point, and that's about the preparedness-response relationship. So preparedness was something actually that also came up a lot in the previous panel, and then we were talking also about what to prepare for, because crises usually come unexpected, so you're not sure what to prepare for. But what you see is it's actually also very difficult to decide how you should prepare for a crisis, because we do not really understand yet the relationship between preparedness and response, and what type of preparation is really effective and helpful in delivering an effective response. So that's something I want to research, and in particular, the fact that some countries that were very prepared on paper turned out to not do so well, or not do, at least not respond timely enough, for instance, in the real crisis. So that's really the puzzle, the academic puzzle I want to tackle. But then this also brings me to my third point, because that's not only an academically relevant question, but also very practical and very real, seeing how many crises are creeping our way. So how can we prepare for crises, and specifically for the creeping crisis we're discussing today and the days before? And how can we do that in such a way that we can effectively respond to and mitigate the consequences of these creeping crises? So yeah, that's for my opening statement, and I'm looking forward to the discussion.
Great, thank you. So I suppose now we should go to Swapnil. So you studied Finland, and obviously that was a country in a very different state in terms of preparedness, and it was very interesting because of that, but it's also still facing some issues with regard to the protracted nature of the threats, yeah?
Yeah, I would have, is it on? Yeah, I would have said that earlier, yes, but now, like Anna-Marie mentioned, we don't know what is the most effective way to actually respond to this current crisis. But I'd like to walk you through what happened in Finland, like the case that I studied. I did the first and the second wave. So I'd like to just quickly walk you through that and then mention kind of briefly what's happening now, which is quite different to what I had discovered earlier. So I focused on the first two waves of Finland and how the government responded. So Finland was seen as a success story. They responded proportionately to the COVID crisis in a timely manner. I wouldn't say it was as quick as Portugal, as Henry will discuss later, but they did identify COVID as a crisis in the initial stages, and they imposed measures by March 2020 already. So some measures were like imposing a temporary and complete lockdown in a local area in Helsinki, just the regional area. There were measures imposed in public areas, on public gatherings, restaurants, and so on and so forth. They had very strict border controls, for instance. So we can see that Finland had like a somewhat early recognition of a crisis. And they were fairly quick to centralize their power by adopting what they called the Emergency Powers Act, which enabled them to impose these measures that I just discussed and ease the pressure on a healthcare system. So they followed this very evidence-based approach, and there was a very good coordination between experts and government, or so I would say that. So you had the Finnish Institute for Health and Welfare, which issued and published guidelines. Then the Ministry of Social Affairs and Health issuing guidelines for healthcare providers. Then there was the Finnish Institute of Occupational Health, which provided guidelines to workplaces. Then you had the Prime Minister Sanna Marin conveying these guidelines and discussing the progress of the virus and to the general public in her press conferences. So Finland had you could say, a relatively effective response if you were to compare to other member states in the EU, for instance. Obviously, Finland wasn't perfect. No country was. So they still had shortages in PPE, shortages in healthcare staff to attend to non-COVID patients. They had shortages in testing capacities. But they were praised and singled out by the ECDC and the WHO for their, having one of the lowest mortality rates and one of the highest compliance rates. And the government also enjoyed high level of trust, which is obviously reflected in how compliant the public was. And according to surveys carried out by the European Parliament, the Finns actually had a very positive attitude towards these restrictive measures, which many of the other countries, the public of other countries didn't enjoy. Finns, on the other hand, 23% of the population admitted that the measures had actually improved their quality of life, which is quite impressive. So that was one main point. And also Finland, we saw that they were able to learn from their mistakes from the first wave. So Magnus yesterday in the panel discussed about how Sweden lacked imagination. And I'd say Finland had ample of that. They had a very stoic approach, as I discussed in my paper. They were preparing for the worst. And they were actually preparing for the second wave in April 2020. So the second wave they anticipated would come after the summer. And over the summer, they increased testing capacities. They trained people for contact tracing. They trained hospital staff to treat COVID patients. They increased PPE productions. They were ready to amend and adopt new laws for the second wave. They introduced face mask recommendations, which wasn't there earlier, much like Sweden. Don't want to single Sweden out. And so this was all part of their so-called hybrid strategy that they were planning to adopt after summer. And so you can see that the government didn't sigh a sigh of relief over the summer. They actually got to work. So seeing what has been discussed in the previous panels, I mean, I'd say Finland ticked all of the boxes. Because I felt like so far we've been criticizing how governments didn't respond early enough or effectively, or there was a lack of trust in government. Here I would say, at least in my opinion and what I have researched so far, I would say Finnish government was fairly prepared. They weren't perfect, but prepared. The public was compliant. There was transparency. They learned from the first wave and implemented all the lessons in the second wave. There was a high level of trust. So I'd say they tick all the boxes, according to the paper I submitted. But recently, the situation has changed. So, and this is something I'd like to briefly touch upon before I wrap up. So the current situation in Finland, they've been recently battling with a fifth wave, with increased hospitalizations, and the ECDC has now placed Finland on a red list. And this might be because of relaxed attention, and although there is high compliance, there might be greater uncertainty and frustration amongst the Finnish population, according to recent surveys at least. And there was also, when the vaccine rollout started, the youth was quite reluctant to actually get vaccinated, despite there being high trust in the government. So you see there's a slight fluctuation in trust now, and there was a dip in trust towards politicians after the second wave, and recently over the summer as well, the Prime Minister encouraged a more lax approach. And this was criticized by the regional state agencies. So we now see more tension and more clash between different bodies that are trying to work together. And before it was all great, they were like a big happy family, everything's working together, but now there's more clash between everyone. And you know, just to wrap things up, I would say, you know, initially, just because we thought Finland had a good and effective response doesn't mean that there was no COVID fatigue developed over time, which is also something that was brought up in the previous panels. Despite there being a good initial response, we see that there has been a development of COVID fatigue in Finland. People are more frustrated, although compliant. And also the Finnish government, they did have an effective strategy in the beginning, but now they seem to have relaxed more, and there are more tensions arising. So really, what did Finland learn? Or did they learn how to respond effectively to the crisis? I mean, in one of the panels, there was this discussion whether more information means less uncertainty and less ambiguity. I mean, here, more information has not necessarily led to a more effective response. It's kind of turned tables, you know, it's gone the other way around. So Finland went from being a success story to what I had submitted in my paper to now being on a red list. And now nations like Sweden are actually doing a lot better, I would say. So
Okay, so Linnea, could you tell us a bit about the Norwegian case?
I think there is a lot of similarities between the Finnish case actually and the Norwegian one, especially during the two first waves. But I think it is important to start with how the decisions were taken in Norway. It was taken in a very collaborative way between the Institute of Public Health, the Directorate of Health, and the government. Even if the government were prone sometime to impose stricter measures that were actually recommended by the Institute of Public Health. And they do not have any form of state of emergency, but the Norwegian constitution consists of a number of laws which gives the government authority to impose strict measures in extraordinary crisis. So early on they also realized that the legal frameworks would have to be expanded to enable quick decision-making regarding new measures. And in the middle of March, the Corona Act passed in Stortinget, which is the parliament. So the law gives the government authority to issue regulations that could complement or differ from the normal legal framework. The Corona Act was in effect only 2 months with the main purpose to mitigate the economic effects of the crisis. And however, it is important to know that the law was also very much criticized because it also enabled a power shift from the parliament to the government. And some members in Stortinget actually said that they felt like they actually had to pass the law just due to the crisis. But early response, I mean, they did the first risk assessment of the coronavirus in January, and 1 month later detected the first case. And the Institute of Public Health early on created different scenarios that were to be maybe expected, and also different measures to impose in relation to those scenarios. So there were a lot of emphasis on the importance of contact tracing, testing, and quarantine. And in early February, the municipalities and regions were instructed to review their preparedness plans, and actually if they lacked resources, they were granted from the government. In the beginning of March, they took on a suppression strategy with extensive testing and quarantine. However, in early March, they found their first cases where the chain of transmission could not be established, and stricter infection control measures were taken rapidly. I would not say, though, that Norway showed any overconfidence, but rather the opposite, using their imagination, as we talked about earlier, and different scenarios to control the situation as soon as possible. Yeah, they adopted a precautionary principle, I would say, but in this case, meaning rather safe than sorry, I would say. because of how the situation evolved, particularly in China and Italy. And the scenario that the Institute of Public Health prepared for was a scenario where over 2 million Norwegians would become infected. On March 12, they implemented the strictest measures ever taken in peacetime and very close to a lockdown, but it was never called a lockdown actually, officially. Anna Solberg, also the Prime Minister, underlined that it was impossible to know if these strict measures would have the desired effect. Also, they applied a knowledge-based approach, as they called it, meaning that the countermeasures would be based on the latest available information and being very honest about the high level of uncertainty and the risk of incorrect estimations. And in the end of April, they started to see this desired effect. And in the beginning of May, the situation was described as under control, moving away from a suppression strategy and instead a control strategy, with testing and contact tracing all possible cases. And when the infection rates were slowing down during the summer, they used this opportunity, like Finland, to prepare for a second wave. But the cases began to rise in August and continued to rise, and the stricter measures were not imposed until October, which is kind of remarkable and kind of touch upon the same thing as you said also about, like, why did it take so long for the second wave when we had all that we needed to know, apparently, almost. So there were certain differences in their handling of the second wave, and the measures were more targeted in the second wave because of gained knowledge about the importance of timely and efficient measures. The measures were described in this targeted way mainly because of two reasons. So the municipalities had shown that they were able to deal with local outbreaks and therefore given more tools to control the spread of infection. And new knowledge about the spread among young children made the government choose to not impose strict measures for that cohort. And they developed a chart of risk levels available at the Institute's website, and depending on the current spread of infection in different parts of the country, the municipalities would be divided into different risk levels. So the benefits with this model is that strict measures can be applied only when necessary and society can remain open in other parts of the country. But it's, however, important to know that the new readiness plan, as they also launched, enabled the government to make rapid interventions in more than one municipality at a time if needed. So for my final point, I would also like to note, like, the compliance have remained high, or at least when this report were written. And the numbers decreased a little bit, but remained on a very high level. And some explain this high compliance as successful cooperation between central and local policymakers and across the public-private sectors. And when the government launched an app to track movement patterns, like a COVID app, I guess, about 60% of the citizens above 18 years actually downloaded this app voluntarily only after 1 week, which is, remarkable. But in Norway right now, as in Finland, the infection rates are on their way up, and new restrictions are on their way, especially for municipalities in the north. And 76% is vaccinated, which is a little bit lower than, for example, Portugal, which is also interesting to discuss further, I think. But I'll leave it at that for the moment. Thank you.
Okay, thank you. Just before I start with my statement, one thing that I obviously want to point out about all of these cases is that, like, while they're all small countries that are dispersed around the European continent, one common factor is that in each situation, the crisis could be seen coming. It had already begun in Italy. There was already full-blown infection in Finland. They had probably more time than anybody else. And of course, they did prepare very well. But fundamentally, this was something that everyone could see somewhere else, and some failed to recognize it while others didn't. And so, well, in my home country, for example, in Ireland, the fact that they didn't quite recognize what was coming at them at the beginning is quite baffling, given that they were already in a protracted health crisis. By November of 2019, the Irish Health Service was already overwhelmed with a seasonal flu case, which was a fairly regular occurrence on the island. They have a lot of problems with sustaining healthcare access and affordability in the country. And this was something that the government already knew was a hazard, and it had caused significant political issues. So while COVID was spreading around Wuhan, there was a vote of no confidence against the Minister of Health, which eventually led the government to, resign before it collapsed. And yeah, there were new elections in which for 40% of Irish people, they said that their major issue was healthcare and having improved access to hospitals and improved healthcare quality. For other people, it was housing, and that's a whole another crisis that's going on there. Their second issue was healthcare, generally. So to compare that to Portugal, it was obviously a country that has experienced significant financial crises in the last periods in the early 2000s and also in 2008, and then subsequently sovereign debt crisis. So people there are no strangers to disruption in their lives, in the economy, and to these kinds of disasters. But yeah, similar to the other cases, Ireland, for example, had to adopt a whole new legislative framework. They didn't have anything pre-existing. The Health Act that currently existed was from 1948, and even in some cases referred to infected people as vermin. If you compare that to Portugal, its modern constitution, which was only created after the revolution in the late 70s, was it was a very specific system, and it kind of impacted their response in this way that they had what's sort of been termed as like the progressive scaling model. They already had an institutionalized system of how they could ramp up measures, and it turned out to be very suited to COVID and responding in that way. And they didn't really have to be inventive in that sense because everything was already written down in the laws. But to a significant degree, one thing that affected how they responded was how leaders initially framed what the goals of the response were. So in Portugal, it was essentially framed as a war. The president, when he was in the process of declaring a state of emergency, said that the country had to give everything and all people in the country had to give everything to save lives. Their singular goal was based on protecting the civilians' lives and making sure that the systems were sustained, essentially. And all other priorities, at least for the time being, were out the window. In Ireland, it was more of a kind of a balancing game, but when it became apparent that they could no longer control the spread of the virus, then measures were introduced fairly rapidly that prioritize protecting people. So lockdown measures, movement restrictions, closures of schools, that kind of thing. What's noteworthy when you go into the later waves, though, is that the list of priorities ended up expanding, and this is something that has been touched upon consistently throughout this conference, that when you're in a protracted crisis, the things you have to consider they broaden. For example, in the summer months in Ireland, there was a very big debate about whether they should open schools again in September because they knew that this would result in new waves of infection. But it was also not just for providing education, because that could be provided through other means, but the important social role that schools played, for example, in providing food to children from lower incomes, from making sure children are safe, from relieving pressure on parents who have been locked up with their kids for months on end. But then what's also important is how citizens acted themselves. So in the Portuguese case, there was a massive drive by the population to self-organize. In the weeks leading up to the eventual lockdown, Facebook groups, for example, appeared with sometimes 600,000 to 800,000 people in them, in which people would share information about what was going on in their community, how how they prioritize assisting older citizens, people with disabilities, that kind of thing. And this was something that was, in fact, praised by the politicians. Yeah, in Ireland, you can see how this sort of turned out differently, especially as the crisis went on. Something that I believe Olivier Boraz brought up in the past days was that measures sometimes were introduced not necessarily to convince citizens, but sometimes to discipline them into cooperating. In Ireland, especially so, October 2020, it became the first country in Europe to go back into lockdown. And what happened here was basically that the health authorities and the politicians that were in charge were deliberating very constantly about like how they could sort of maintain, well, an open society, keep businesses open, keep schools open while keeping the spread of the disease low. And where this ended up was that the politicians were saying, but you told us that if we have these social distancing measures that it'll be fine and that people will be protected from each other. And they said, yeah, but we need measures that are actually enforceable because people aren't complying. Yeah, we could have level 3 restrictions where people have to wear masks and they can only socialize with people within their household. But if they're not doing that and we can't force them to do that, then it's not going to work. And then finally, what's really noteworthy about the Portuguese case in particular is the sense of vulnerability. To use the terms that Magnus Ekengren brought up yesterday, they didn't fail to imagine, as others did, what was coming for them. The health authorities were in fact very open that they themselves did not know what they were going to do. And for example, there's one quote from the Director General of Health, which was on March 9th, about 6 days before the first death of COVID-19 in Portugal. And Dr. Graça Freitas said, we have not experienced a disproportionate and exponential growth of the disease. The containment measures seem to be working. However, the behavior of the virus may change. So far, we are calm. It does not mean that tomorrow or in 2 or 3 days, we cannot be in a situation similar to that of Italy. We just do not know. And while many scholars would maybe look at this and think this is not really what you should be telling the citizenry because you would want to inspire confidence, this was something that led to a lot of confidence and a lot of approval of the government. The president, who was one of the main proponents of this idea, was re-elected during the worst part of the crisis with an 85% majority. And there was very high approval of the behavior of the health authorities and their openness. And this is in a country where initially, yeah, they were afraid largely because they could see what was going on in Italy and they knew that they were in their own country less prepared to respond. There was about a study done at one point where 54% of healthcare workers in the National Health Service did not believe that Portugal was ready to face COVID-19. And obviously, similar to Finland, by January, it took some very dark turns in Portugal, and this was kind of the game of trying to experiment with new measures. But yes.
No, I had this point where you said, like, it sounds like in Portugal, the people really took control. But I just wanted to, like, ask, do you think there was COVID fatigue that developed over time in Portugal? Because I feel like in Finland, maybe the people relied too much on the government, or the government really took control, and they trusted the government. And although they complied and they agreed with the measures, maybe, you know, eventually because they were not in control, like they developed COVID fatigue. I mean, that's the question that's in my head with this whole U-turn that Finland's taken, this whole case, you know, going from success to like on the red list. So I don't know, was that something that's developed in Portugal now, or do you have
kind of interesting that you brought that up because So when you look sort of more towards the period of the second wave around November of 2020, surveys were done where people still had a very high risk perception of COVID-19, especially among younger people. It wasn't so much that they were afraid for themselves, but they were very afraid of what would happen to others. But one thing that became sort of a very salient point was that they knew after the first wave the economic consequences that full lockdown had because they were very quick introducing lockdown measures on March 18th. Only one person had died in the country at that stage. And so the governments were very quick in that way, and Portugal escaped the first wave with very few deaths, fewer than Sweden, even fewer than most other countries here. But what became a significant problem was that people understood that if the disease expands, if more people get it, we're going to have a lockdown, and we can't afford that. And so they became conscious about protecting each other and protecting themselves because they knew that they couldn't let it get to that stage where they needed to have lockdown measures.
Sorry.
Go ahead.
Okay. No, but I also think it's very important to notice, like you said, like what was the main goal actually about? And I think for Sweden, for example, as we've talked a lot about, maybe it was a bigger public health perspective that you took into account, where in Norway, for example, there was like infection control measures that were in focus, and also, like you said, they wanted to save lives. That was the main goal. So I think also that is important to take into account when we are comparing different countries, like what is the actual main goal, like, because you can criticize Sweden all you want, like we have done it a lot this past couple of days, but I think also if you look at from a broader perspective of what the actual purpose of these less strict measures was actually from a broader like public health perspective, and taking into account the negative effects it might have on children and so on. And also like that these measures, and maybe also that's one of the things that we now see that Sweden is maybe doing better than maybe Norway and Finland regarding infection rates and so on. But also these, as far as I am concerned, at least, I'm not an expert in the Swedish case either, but I lived with the restrictions. So I think they implemented measures that we could have for a long period of time, because they also knew, maybe they knew, I don't know, but this is my own analysis of the measures, but that we could live with them for a long period of time, because these crises are not going to be over in like 3 weeks. And you cannot just like lock down a country all over again. So maybe like in the long term, maybe these more relaxed measures are to are better than the lockdown ones. I'm not sure, but I think maybe that explains why some countries also maybe experience a high percentage of COVID fatigue, as we mentioned earlier, by having to go into several lockdowns during a very short period of time.
If I can add on to that before we go maybe to the question online as well. I think that's a very interesting point, because I think in the Netherlands we've had the trouble of thinking in long term, and we've discussed this, and obviously it's a challenge. It's very hard to think in long term when there's so many pressing challenges short term that as a government you have to deal with. Yet what has been criticized a lot in the Netherlands is this summer of 2020, when after the first wave we started dismantling our measures, and basically, to put this quite provocatively, the government went on a holiday, as all our citizens went on a holiday as well. We even went abroad. It was allowed, to my idea, quite surprisingly. And as a result, partly because of going abroad, we brought back the virus with us, and so the second wave started after the summer holiday. I think it's interesting that within the Netherlands we thought with this, as was written down in our preparations as well, that we were prepared for a wave a one wave, more specifically. There were some plans that would take into account a second wave, but both of these waves would be about 6 to 8 weeks. So this is relatively short term. So also according to WHO literature, we didn't expect our citizens to accept having their freedoms limited for a long period of time. So first lockdown was, I think, about 2 months maybe. The second one, we started, during the second wave, we started imposing measures in September, which was relatively late. Yet in October, we added some measures on top of it, and only in December, so 3 months later, we got into a second lockdown. So you also could see that politicians were very hesitant to put another lockdown, to put the citizens in another lockdown. And I think it's interesting to see that possibly by implementing softer measures, the long term was maybe taken into account more than, for example, the case in the Netherlands.
Okay, thank you. Yeah, now see that Olivier wants to talk to us from Paris.
Yeah, thank you very much. I mean, these were really great presentations, and I learned a lot. And I think it's really important to have these types of case studies to be able to clearly see the differences and the similarities between countries. And it struck me that, I mean, there were some, I mean, between France and Netherlands, clearly there are many similarities. The fact that we had prepared so much for a crisis like this and then didn't use any of the plans or procedures. And I guess it has to do both with the fact that this was maybe a different type of crisis, but also the fact that, I mean, clearly in France, there was a decision, a will not to implement the plans. They didn't want to be tied up by the plans and by the procedures. They wanted to remain free in a sense to manage this crisis. And I think this is an interesting decision, which we still have to understand. But it was not just that it was a different type of crisis, it was also a decision that they needed something different to manage this situation. The other similarity with the Netherlands is the summer. We had exactly the same thing. I mean, in June, Macron goes on television saying it's over. You know, we can go on holiday, have fun, party. It's over, and we've discussed with many experts and officials in the administration and expert bodies and they said afterwards, they said, at the back of our mind, we sort of knew there would be a second wave, but we didn't want to believe it. I mean, we just wasn't, I mean, it had been so exhausting and such a strong experience, it had to be over. And so they just, I mean, but they recognized the fact that deep down they knew that there would be a second wave. I mean, but they just did not want to believe it. It was sort of magical thinking. And moreover, as I said, I think the other day, but which I think is the case in other countries also, during the summer, many civil servants changed positions. So many people left. So basically we just disarmed everything during the summer. So I think it's very close to the Netherlands. I think what Linnea was saying also is very important about Sweden. I think Sweden's choice to apply a broad public health approach is a clear difference with, for example, France. In France, we focused exclusively on COVID, and we discarded any other consequences in terms of public health. And now we are still starting to see the numbers on mental health, on the cancer detection, cancer treatments, AIDS. We're starting to see that the larger public health consequences of the measures taken are actually quite significant, and may actually be larger and wider in time than the number of deaths we were able that we had, or were able to avoid. So that comes back to the discussion this morning about ethical choices. Just two last points I want to make. I think comparing countries is really very difficult, as we've seen already, because, I mean, countries don't count death the same way. I mean, the way the Swedes count death, COVID death, is nothing to do with the French. We do it in France. So comparing death numbers is already very difficult. But I mean, there's so many other points of comparison that make it very, I mean, if you look at Sweden compared to Norway or Finland, I mean, the degree of connectedness with the rest of the world is much higher in Sweden than it is in Finland and Norway, for instance. Immigrant population also is an important factor to take into account, much higher in Sweden. The status of the retirement homes is also the way they're organized, the people who work in them is also very different. So that introduces many confounding factors that make comparisons extremely, extremely difficult. But at the same time, we need to move ahead. I think we need to find points on which we can compare. And as I said, for example, just the way the expertise was organized, the way why they bring the summer, some countries disarmed and not others, is important. Finally, last comment I want to make is, during these last 3 days, we've sort of made the assumption that government action has a direct impact on COVID, on the virus. It's like you're pushing buttons, and so some say, well, we should push the button harder, less harder, sooner, later, et cetera, et cetera. But we were based on this. We make an assumption that governmental action has a direct effect on the virus, the spread, the number of deaths. And I think we need to be very careful with this type of assumption. There is no clear evidence that this works as a direct causal factor. In France, for instance, now we have studies showing that actually it's probably behavior changes before the lockdown that actually lead to the change in the pattern of the virus. So it's not. So I think we need to be very careful in thinking that there is a direct link between government action and the virus. And just last we know, I don't know if it was Anders Tegnell or Johan Carlson who said, no, this is not a 100-meter race, this is a marathon. So we'll see at the end of the marathon who wins. And I think he was right. Remember last year, New Zealand and Australia were large success stories. Now, so I think it's once again, we have to be careful in terms of comparisons. We have to be careful in assuming that there's a direct link between government action and the behavior of the virus. Thank you again.
Can I respond to that? Because I wanted to come back on your point on preparing countries, because the interesting thing is that we, of course, all have these case studies done, and I was thinking maybe we could prepare among each other a little bit, because these countries also differ very much in the extent to which they also had experience with previous crises. And if you read the literature on preparation and response, you see that many actually point to the experience with previous crises as an important indicator or factor making countries more or less prepared for crises and making them able to respond effectively. So what I saw is that, for instance, in the Ireland case, they already were struggling with difficulties in the healthcare sector, but also you wrote in your paper also that they had experience with SARS. And what you see in the Netherlands, for instance, that we actually tackled the Mexican flu a couple of years back quite well, which actually led to maybe being overconfident at the beginning of the crisis that we can manage a large disease, a large epidemic, but then COVID-19 turned out to be of a much larger scale. So I was wondering to my fellow panelists, so how do you, in your cases, look at the role that these previous crisis experience played in the response of your countries?
Yeah, I'll quickly respond. I think it's working. Yeah, I think that's a great point, because I actually kind of skipped this. I was hoping I'd weave this in the discussion later. So I think Finland had a lot of pre-existing advantages, and that's why it was easier to call it a success story. But we mentioned now, every country is different, so it's harder to compare. So for instance, Finland has one of the lowest population densities in Europe. So obviously that's already an advantage in this COVID crisis where you are supposed to maintain social distance. Finland also has always had a very strict border policy prior to the crisis. And it wasn't one of the first countries to be hit. They had time on their side. They had other countries that they could look at before they had to act themselves. And also, I would say, I'd like to point out that Finland has a very reserved culture. Maybe that's also, something in Sweden and Norway as well. And that's something that plays it plays to their advantage in a crisis like the COVID crisis. And one thing that I also found that was very fascinating, I was quite impressed by it when I found out, that in Finland, key actors, and I think it's every year, they participate in what's called the Finland's National Defense Corps, where key actors from different sectors like the agricultural sector, logistics, healthcare, banking, so on and so forth, they meet and they prepare. They are prepared for crises such as war or pandemics or cyber attacks. So they are actually, they prepare themselves okay, this is what you need to do when there's a cyber attack or a pandemic. So they basically prepare for war-like conditions. I think it's every year. So exactly what you said, some countries are just, they just have systems in place where they prepare more, and some countries are just different. Every country is different, and I think Finland had several advantages. prior to the crisis, and that's why it was easy to, you know, kind of label it a success story. But now we see that, you know, the situation has changed so much, like it has in New Zealand as well. So I think that's very relevant for the Finnish case.
Okay, that's a good point you made, and I'm just going to say one thing before we go to a question from Paul Kearney, who's calling us from Scotland. Yeah, I think it's very important, actually, the point that Olivia brought up about the assumption that governments actually have some kind of effect on how the disease is progressing, and I think it really relates to like the Ireland case specifically, because they were trying for so long to introduce measures and get people to comply, and like while you can get people to do that, obviously not everyone will, and you have very densely populated parts of the country where measures will be more effective than in others. But in the end, you might have to resort to more coercive, more controllable means wherein people are forced or compelled to obey rather than convinced. Just one other thing I wanted to say was because everyone seems to have pointed out that at some point, while the authorities seem to have information, like for example with Ireland, they had the SARS experience, which wasn't much in fairness. They had literally one person that got SARS, and that made them quite overconfident because they were like, right, we isolated that one in the airport, brought him to the hospital, he never even saw anybody outside checking. But when you look back at like what they were saying at the time, what the health experts were saying, even in March of 2020, even February of 2020, they had a very clear understanding of what COVID-19 was. They knew it was a super spreading virus, yet they weren't able to translate that effectively into measures. And so there is clearly something wrong there. But to Paul.
Actually, so your discussion reminds me, I was in Ireland in February 2020, and it was just before they'd stopped the Italian rugby team going over there because there was infection. And I remember at the time, most people thinking that, they were wondering why there was such an overreaction. Okay, so, but my question, I think, was more to do with Norway and Finland, because I suppose that the thing that I haven't seen in both reports yet is that both of them are politically important in terms of non-communicable diseases. They're both seen as best case examples of, good long-term approaches to non-communicable disease in terms of, long-term thinking and collaboration. And they have a kind of decentralized model for that. So, if organizations like the WHO are pushing things like health and all policies, to reduce health inequalities and improve population health, it's often Norway and Finland that they point to as relatively committed to it and relatively conducive to the impacts, because the whole kind of framing is sort of anti-neoliberal and pro sort of Nordic style democracy. So in that context, I think you would expect fewer unequal effects associated with the social determinants of both communicable disease and non-communicable disease based on their wider, longer term starting points. And I wonder if you've picked up on any of that language, so to compare in the UK, people will say part of the problem was the unequal impact because some people are able to live and work safely at home and some people have to go to work or they're not funded to isolate. There's a big issue in the UK that it's you lose money if you isolate after testing positive, whereas my impression in countries like the Nordics, you don't lose money. So is that kind of thing come up?
Yeah, I could start. Yeah, this was actually something I was, I guess, going to bring up later as well. But like when you kind of, how do you know a country has responded effectively? And if you look at the health consequences, I would say now Finland is deteriorating. But then I was going to focus on the socio-economic consequences. And as far as I know, in the surveys that I've looked at that surveyed the Finnish population, I think the socio-economic conditions have remained quite stable. I think Finland did quite a lot to make sure that, okay, it doesn't impact people's income. So when you look at surveys, the Finnish population was quite confident regarding their income, and they felt that, okay, these restrictions and this crisis will not impact their income. And in terms of psychological consequences, well, now there's a rising fatigue. But yeah, the socioeconomic consequences I felt in Finland, and looking at the surveys, the Finnish population was quite confident when it comes to that. And that has remained quite stable throughout these, well, 5 waves that Finland has gone through. As opposed to, well, healthcare, like the restriction to the COVID fatigue, I mean, I guess that's increased. Before, you know, the public was more certain, and now they're more frustrated. But in terms of, you know, economic impact, they have remained quite confident. So I feel like that Finland has addressed that issue. I'm not sure if Norway has done the same.
No, I think I agree with you, because I think it's quite similar there. I mean, they're a quite stable economic country, and I think there haven't been a major impact on the economy either. Also, I think like during the second wave, the measures taken were quite hard, but they also they were very targeted and very specific for like work life, social life, at home. So they were all divided into these different categories, and I believe maybe it's because to enable people to actually do something or go to work if you're forced to go to work, for example, and so on and so forth. So I think I agree what Swapnil said, and I think a lot of it's true for Norway as well, actually, because it's a Nordic country, you know, a lot of similarities over and all. Yeah.
So I know in the case that I researched in Portugal, it was more similar to what Paul was saying about the UK, where throughout the protracted period in the middle of the first and second waves, a problem that they had with keeping cases down was especially younger generations who obviously don't tend to have as much income and who are more dependent on going to work. Yeah, they had this issue where they would lose out if they did not, if they got COVID, and so they would not get tested deliberately and continue going to work. But before we continue with any more at that point, I see we have 2 questions out in space, but firstly, there's one in the room.
Yes, can you hear me? Okay. So hello, my name is Katerina. Well, this question I've had throughout all these days that we have this conference, and I guess I will ask it to you guys, because it applies to basically a lot of the phases of managing a crisis. So about COVID, during the first wave, I actually experienced it in Greece, which was not great. But then I experienced it in the Netherlands, which was also not great. So I got the worst of both worlds on how you can deal with the phases of a crisis, I think. For me personally, I don't think I expected people to give me an explanation on why this is happening, how we're dealing with it, why we're choosing these ways. But I think what I expected was some sort of crisis communication strategy that I could trust. For example, who are the people I can listen to, who I can actually trust, the experts, the politicians, the professors. Who are they? What can they tell me to make me feel safer? And in both cases, in both countries, I think what happened was that I actually missed that. I didn't have a clear vision of what was happening, and I understand that they also did not have a clear vision. But I guess in terms of preparation and response, what I expect is that you can prepare on how to communicate something. So I wanted your opinion on that, maybe based on your case studies, because I was not familiar with these countries and the responses, but I was familiar with Greece and the Netherlands. So I would like your opinion on that. And maybe the thing is, how can we know who to listen to? Because I know for Europe, there was not one linear solution of the problem. Every country had their own answers, their own responses. So I was wondering, can there be one specific or something that contributes or something that combines a more good way, a better way to deal with something. Because for me, when, for example, I had to travel, I had to look up to so many different rules. I did not want to travel. I did not want to do anything, basically, to try, because I was like, what's the point? So I was, yeah, so basically that was my experience with COVID-19. Like, what's the point to even try, to even listen to the people, to even not abide by the rules, but basically understand them. I did not understand the rules. So basically by the end of it, by basically May of 2021, I was basically done with trying to understand. So I was just waiting for the next thing to come. And quite frankly, I'm still waiting for it. I don't think we're done with this. So yeah, that is my question. I mean, my comment, I don't know what that was, but thank you.
Thanks. I think like just one quick answer that I could give would be that like from what I saw, like in the countries that I researched, it was a lot to do with, well, you had these health experts and political leaders who were busy in communicating information and telling people what they should do, how they should think about COVID in a way, how far that they should go with that. And in some sense, a lot of them lost a lot of credibility. And now, like, if you go on any social media site and you look down the list, you'll see like politicians all over the place, caricatures of them, and it goes on saying that like, oh yeah, like why am I allowed to only sit in a bar with 5 people, but I can attend a wedding with 200? You have that kind of thing, and so people's confidence has gone well, wayward in that sense, in those kind of institutions. And maybe, yeah, there's only so much of a degree to which you can convince people how to think about these things. After all, they all have their own mind and will go their own way. But yeah.
Yeah, if I could add to that, basically you had like 2 statements or questions, I guess. The one about one common voice in Europe, I think that's very hard, as we heard in the discussion about international cooperation as well. Basically every country started to tackle this crisis with a national response, and I think that initial response made it hard to eventually create a European response in a sense. Eventually they sort of worked it out to have a system to grade the travel advice, yet this was still eventually per country. And the second comment you made about trying to explain why it's happening and why it's happening. In the Netherlands, we've seen quite a strong communication after, like a little hiccup at the start, from our Prime Minister and our Minister of Health, as they repeatedly showed up to frequent press conferences with the 2 of them. You could argue, though, that their explanation would reach a higher class or higher educated group of people more than, for example, the lower educated people. This was something they could have focused more on, for example. Also, they've had to switch around their strategies by, instead of announcing the restrictions, into providing options to do something another way, like, for example, go outside and have a walk instead of stay at home all the time. And specifically aimed at students or like young people as well, as we mentioned before. It's quite interesting that at the start of the school year, after the summer of 2020, a lot of students would have their introduction week and would have a party. They were missing out on all of this, and even a slight blame game could be detected at that time because they showed up to have high levels of cases at this end of the summer. It's interesting that at first, where the blame game started, as you have to think of your grandma, like, don't infect her, you know, because you might be fine yourself. Eventually this turned around and they tried to incorporate more young people in designing the strategy. The results of that I'm not aware of. I don't know if it worked, but at least they were aware at some point and put in some efforts.
Okay, one quick point from Linnea that she wanted to make, and then we're going to go to Andrea.
Yeah, I would like to add something to the question we had before, actually, because now when I started to think about like socio-economic impacts, in Norway and in Sweden, it was a common problem for the border closed down, and the border controls were very hard in Norway. So people working in Sweden or people working in Norway couldn't get to their works and remained without income for a long period of time, which actually was like a very big problem in both countries, how to solve that. So just to add to that other question, and also one thing that came to mind when I thought about your question was that in New Zealand, for example, the Prime Minister was very praised for catching up with people through Facebook and asking like, how are you, and stuff like that, making it very personal. And I think maybe now we see maybe they're not doing as well as before, but I think in the beginning maybe that was a good strategy, just to reach everybody, and also people that might not necessarily know all the different concept of like crisis management and health and stuff like that, because I think I realized that a lot in Sweden as well. Like at the press conferences, the people talking were working with this, and they didn't necessarily understood maybe who they were talking to, and trying to like maybe maybe switch the message a little bit just to make everybody understand what was actually happening. So yeah.
So you're saying that you should try and keep things on a very human-centered level, and not use a load of jargon and okay, well, fair point to make, probably valuable. Yeah, and Andrea Menchen, you have something to say, no?
Yes, I would like to thank all the panelists for the very insightful presentations. I would be interested in hearing the panel's views on a topic we haven't really touched upon that much, and that concerns the geopolitical dimension of crisis management, creeping crisis management, and the COVID crisis. I think what we have seen is that it's really territorially bounded nature of the responses, and if it's about saving lives within the national jurisdictions. We also have seen revival of national protectionism, for example, when it comes to organizing our access to PPE or vaccinations. And I would be interested in hearing a bit more your reflections on the relationship between sort of nationally bounded crisis management and the effects or repercussions of then the possibilities for transboundary management of the COVID crisis and global health management.
Go ahead, Anna-Marie.
Thanks. Yeah, because I think that's indeed a very interesting and relevant point. I was also thinking about this specifically in relation to the COVID-19 crisis as a solidarity crisis as well, because what you see now with the vaccination distribution, and I think that will be very interesting how that will play out actually, because what if the condition for losing all restrictions, for instance, in the Netherlands or some of the other countries we're discussing here, would be to give us all like a third booster shot. So do we then give that priority, or do we divide the vaccines first and make sure that we have like that level of protection more globally? So I think that's a very interesting point, and I'm also curious to hear what the others reflections are on that.
Yeah, I mean, I could say in terms of what Finland did, Finland actually, once their situation got better after this summer, previous summer, not this summer, they actually helped out Sweden when Stockholm's ICU capacity had reached 99%. So Finland actually helped out, and I read also today, like a couple of hours ago before the panel, they, although right now Finland themselves are on a red list, they have decided to help out Latvia. So I feel like, I guess Finland has this sense of solidarity that crosses their border, it's more trans-boundary, and although they themselves are in a very critical situation right now. So.
Okay. Yeah, at least, so what I found in the two case studies that I did was that there was especially a massive, international pursuit in the very beginning for procuring personal protective equipment, most of which on Earth is produced in China. And yeah, this caused some problems for certain countries that didn't have stockpiles. Like I know Finland was very prepared in that sense. Portugal did have a surplus of masks, but not medical PPE equipment. And so there was this massive diplomatic offensive. Like there was one a Portuguese diplomat in Beijing that was basically saying that the Portuguese embassy in Beijing became like a warehouse for medical equipment, that they were literally piling stuff up in the hallways and chartering flights to bring it back to Lisbon. And this was very similar in Ireland. And I mean, it's all very sad, but there were actually some hilarious stories that emerged. Like there was one plane load of personal protective equipment that came into Ireland from China. And they made a massive like news event out of this. They were escorting like the trucks out of the airport with military vehicles, all that kind of thing. And then it turned out that the personal protective equipment was not in the size that could fit most Irish healthcare workers. And many of the gloves didn't fit them. The goggles were too small. They couldn't work with it. But yeah, there was like a considerable lack, and I think it came up in one of the panels yesterday on international cooperation about, well, they weren't like really sharing as much information as they could have. They weren't sharing equipment, and especially one medical practitioner that I interviewed who was involved in this, he told me that even when it came to things like scientific research about the COVID virus, that there were a lot of concerns in some circles that, for example, the academic research that was published in China wasn't necessarily trusted by Western scientists, and they didn't believe in the credibility of it. There were some methodological flaws, and for this reason, basically, they kind of underestimated, in some senses, the risks because they didn't trust the science. Do you have something to add, Linnea? Yeah, go ahead.
So, well, for Norway, in their long-term strategy and plan for handling the COVID-19 pandemic that was released in May, actually in their worst-case scenario, they lay out that international cooperation is weakened and the international organizations are not seen as legitimate and lose their ability to act. And the international market become dysfunctional. And this scenario is described as possible if countries are looking inward to solve national problems and might lead to export bans on medical protective equipment and so on. And I mean, this was released in May, which is very interesting because in the beginning of the pandemic, that was a big problem in EU with export bans on PPE, for example, and stuff like that. So I think maybe throughout the pandemic, the countries realized that international cooperation is actually very important, but the bigger picture, I mean, I think especially China and Russia used the pandemic in a way also to promote, like, they had PPE, we can give it to you, and so on, and use that as leverage, maybe. So I think that's also an important aspect to take into account when looking at the geopolitical side of it. Yeah, that was my point.
Okay, great point, actually. But yeah, just one thing I actually wanted to mention on this before we go to Janne, that yeah, on a very fundamental level, like not even looking at states, like one important thing to remember is that like countries in the modern world are extremely interconnected. Like we have this whole economic system that's entirely interdependent, and there were even issues not just in the countries that I studied, but I know from other cases where like immigrant workers were a very important thing, that like seasonal workers that would come into the country, they couldn't even get anymore because of COVID restrictions, and then authorities, when they did allow seasonal workers to come in, were castigated basically in the media and saying like, how could you let this happen? But it's sort of something that you probably really need to remember when you're thinking about this kind of problem, because if you don't cooperate, if you just prioritize what's going on within the country, your systems are still going to fall apart. You're going to be hurt, and you can't solve an issue like a pandemic, but also all of the issues that stem from it. You're just going to create more problems. And cooperation is a pretty key thing to focus on. But yes, Janne Hykkönen.
Yeah, thanks. I think this happens sometimes in discussions like this, that I'm sort of going back to one of the comments that I think Swapnil was mentioning in the case of Finland, the preparedness exercises and sort of, or the national defense courses. And it's only, I mean, my understanding as sort of a citizen who's lived through this pandemic is that Finland was actually fairly resilient and largely due to this. Well, the overarching concept is comprehensive security, but the way it is played out in actual life, in sort of the normal times, is that we have not only these annual defense courses, which is sort of, it collects the elite, the business and the public administration and the non-governmental organization elites of the country to a 2-week exercise. And they're invited and they go through different kinds of crisis scenarios. And it's fairly intensive, but I mean, you can imagine we have 5.5 million people and there's not that much elite. So the elites keep going through these defense courses several times in their professional careers. In addition to that, every government undergoes a national security, sort of high-level national security exercise during, so that's once in 4 years. How many regional governments? We had 7 or 8 regional governments. They organize annual preparedness exercises. We just observed one a few weeks ago. The largest cities have their preparedness exercises. The security supply system that we have, they have their sort of sectoral, be it water or electricity. So this country is full of exercises, and I think that the background I heard is I interviewed the then director of the defense courses some years back, and he told me that it's post World War II. Our first fights there were, it's called the Winter War with Russia, or then Soviet Union. We were sort of caught by surprise, and in a sense, the military elites and the country's political elites after the war decided that, well, this should not happen ever again. That's the historical background for the defense, the annual defense courses, which in a sense created this, that we just keep on exercising. Now there's a flip side. This may be, I want to raise this point, which may be an interesting point from the point of view of creeping crisis, and it is this which I have encountered when organizing these exercise, sort of strategic crisis management exercises, where the idea is that, well, it's one thing to put out the fires, but it's another thing to prepare, critical infrastructures for repetitive socio-ecological disruptions. That, you get those floods and fires annually. Does that have implications for the longer-term strategic plans? And it seems that it's really difficult. I mean, our challenge is to try to exercise that, create exercise, in a sense, strategic preparedness exercises for that. And mentally, it is extremely difficult for the participants to divorce themselves from putting the mode of putting out fires. So in a sense, it's you illustrate a chronic crisis, what it might look like, and immediately the reaction in the game or the exercise is that, well, how do we put out the fire that you have just shown us, rather than thinking about the implications for the longer term strategies. So that was kind of my observation.
Hey, thank you, Janne. It's just a question that I wanted to pose to all of the panel, actually, just to kind of draw more to a close. Yeah, I kind of want to borrow a point that Olivia Borràs brought up earlier about the assumption that governments can be effective in all instances when it comes to this type of protracted crisis. And I mean, we're all very familiar now with each other's cases, and you've all extensively studied your own countries. And so I wanted to know what all of your thoughts are basically on what in the case that you chose made their responses effective and what was ineffective. Swapnil?
Yeah. Well, in the Finnish case, and like we just discussed, like they are preparing annually, and not just one thing, it's several things. It's regional, exercises as well. I felt that, okay, initially, at least the initial response was, owed to the fact that the government had all these measures in place. They had all these things in place that they could actually adopt. But again, like I said, there's also the cultural dimension. That there is a culture, and that's not something the government makes. I mean, that's not owed to the government. I think, the fact that the Finnish culture or the Swedish culture, Norwegian culture is quite reserved, I think was also, it played a huge role. And demographics as well, the population density and, the population in general. So, I mean, that's something the government hasn't just, they haven't defined it per se. So I think those are some aspects that actually, well, at least in the Finnish case, really worked to their advantage. So in my case, I would say, yeah, okay, to some extent, it wasn't just the government. There were other factors in play that they just exist.
Yeah, I think that's very interesting. I think culture is a factor here, definitely. As we in the Netherlands are relatively more individualized, so we don't necessarily have that. We have to protect our society. It's more like I have to protect me and my close friends, in my opinion. Interestingly enough, I also think that what Linnea mentioned in her first statement is that in Norway they had a regional response. In the Netherlands we actually tried that. It didn't work. Possibly, obviously, because the Netherlands is smaller than Norway, but also we were talking about a waterbed effect. So if one region would not have measures implemented, the people from that region, from other regions would go there and still take the virus with them. So I think it's very also depending the phase of the crisis, what is effective, what is ineffective. Like, for example, as people mentioned already, during the first phase, you have the rally around the flag effect. So people are more willing, and they have the solidarity, and they understand why they can still do it. Yet over time, this slowly trickles down or declines. And I think what was relatively ineffective in the Netherlands is that the government tried to apply the same strategy from the first wave during the second wave, and as citizens got tired and understood more, since the government also understood more and more knowledge was there on the crisis and the measures, applying the same strategy was relatively ineffective. But it's a hard question to decide what's effective and ineffective, because it also depends on how you measure it.
Can I just pitch into that one? I think it's also, I think in the Norwegian case also what worked well was they had like legal frameworks very quickly changed in order to cope with the crisis, and also realized quite early that you need to maybe have these targeted measures, and we're very prone to like change their strategy depending on what new knowledge came about the virus itself. However, I do think, like you mentioned, people would go to other regions instead if they closed down. In fact, this wasn't possible in Norway. So they closed down. You weren't allowed to go anywhere and I think maybe that's a failure in the beginning. Like when they were very close to a lockdown, I will just call it lockdown, but if officially it's not called a lockdown. So people will go to their summer houses, which is very popular in Norway as in Sweden. But that happened a lot, so people went to smaller municipalities instead. And what happened were the hospitals there couldn't cope with the high number of infected people that ended up in these small municipalities. So it became actually a scandal that you were actually banned to go to your summer houses in other regions, and the municipalities were grateful for that, of course, but the people were not as happy about that. So I think that's also a failure. Because we also talked about this earlier, like face masks was not like very big of a debate in Norway, but they rather focused on like border controls and stuff. And I think that's also possible to apply like inside the country on a national level, that you weren't able to go everywhere you wanted, even inside the country. And I think that might be quite of a failure. I wouldn't say failure maybe, but implication at least. Yeah.
Yes, and then I'll be answering this question on more of an organizational level, as that was the level of analysis I studied. So on that level, I think, so what I witnessed is that the plans did not really match with the reality of the crisis. And I think from that point, it can actually go two ways, because some examples, people really stuck to the plan anyway, and made their crisis response actually very rigid, ineffective, sometimes even counterproductive, I would say. But then a successful response in this case would be actually just letting go of the plan, or at least letting go enough to ensure an effective response with effective improvisation. So I guess on an organizational level, that were really the success and failure factors I would identify. So I guess you're the last to answer the question then.
Yeah, so I think at least I can draw on 2 points pretty much. And one of them is that, well, so in a lot of these cases, especially like, well, we saw it sometimes in the initial phases, but also like between the waves of the crisis, that there was a lot of exceptionalism in the way that a lot of things were planned. Like, oh, this won't happen here. Like, and if anything, it's more of a lesson for contingency planning, I suppose, because yeah, you need to think like kind of, if something goes wrong in another place, it can go wrong here. Like there needs to be an internal evaluation of like, what are the risks specifically to our country? Like, look at the system and what will happen. Even if you did the basic maths and you looked at like the rate of reproduction of COVID in, say, an Italian city, which they did have that data at the time, and then you compare that to how it would perform in, say, Stockholm or Dublin or whatever, you could calculate the risks. And this was what led to the lockdowns, at least in the two countries that I studied. So in Portugal, they didn't actually have enough testing capacity to gain an accurate picture of what was going on, and all they knew is that they had about 2,000 people that were unconfirmed cases because they'd registered for tests but couldn't get a result yet. And all they knew was that this was increasing. And they took measures against that. And in a sense, that was successful. The other thing is that, at least from the Portuguese case, was that they placed significant trust in the public. I mean, obviously their measures in the beginning were very harsh, but afterwards, when things were lifted, when restrictions were lifted, and they began sort of to enter this phase of a more protracted crisis response, they placed a lot of confidence in the public and how they would conduct themselves individually, and the role of essentially politicians and the health experts was to communicate what the risks were clearly and what people should do to protect themselves. And this, because they were so forthcoming in how they communicated the risks, and that the government itself wasn't capable of handling the threat, and that people had to act themselves, and that there was this responsibility on them to protect themselves and others, it was more successful in that sense. And you can see that reflected in things like Portugal now has one of the highest vaccination rates in the world, 85%. They also have a very high rate of mask wearing and that kind of thing. So yeah, I think that's how I would wrap that up. And I think we have one final thing coming in from Arjen.
This is going to be very final because we're going to bring this to a close. First of all, I want to say thank you to this panel. This is, in many ways, the most important panel that we've had here because it's the bridge to the future. It's the bringing in the young future scholars. And, you know, we told them, run your own panel. And I think they've done a splendid job. You know, very well prepared. They've delivered their research, and I think they managed, as we then say in the business, they managed to sell it, which is great. And so wonderful job, guys. And this brings us to the end of our conference. So 3 days here in this setting, and you know, I'm not going to summarize anything. I'm just going to say that I think it was a great conference, and this is just the moment where we thank all the people who helped us, and especially all the people you can't see. And it would be great if you could just turn the camera around or something. It's not happening, of course, but no, Will's not going to do that. But we have a wonderful crew here with Brian and Will at the heart of it, making sure that we could do all this. And beaming in all these people from, and very reliable, we like to talk about high reliability research. Well, this is very highly, everything worked, this is fantastic, so thank you so much. We've had our people joining us, both in the virtually and hanging out with us, and here and watching us on, apparently I just learned that another stream that people just watch that. So I think this is just all great. Symbolically, you know, we started out, and the weather became fantastic here in Leiden, and and I'm looking out. You can't see that, but it just began to rain. So I don't know what that means, but we just had the best of it. So thank you very much, everybody. This is a first step in a larger project. It's not the first step, second step actually. So you're going to be hearing more from Magnus Ekengren, Mark Reinhardt, and myself, trying to push this forward, and we hope we can count on everybody's you know, support like this, and continue this journey as we're trying to learn the lessons and enhance crisis management capacities. Thank you so much, and we'll see you soon.